Over the last 2 days, we covered most of the emergencies on pitch that we can face when we deal with football medicine. We go through sudden cardiac arrest, through concussions, through the components of medicine FIFA medical bag, through the principles of doping control, and also through other clinical emergencies that we may face dealing with footballers.
Yeah, we go through also all the doping control procedures. The participants know the banned list, the prohibited methods of the World Anti-Doping Agency.
The Guyana Football Federation will benefit tremendously from this program because a lot of the information is really needed, because a lot of our personnel that attended the program didn't have the necessary knowledge. So this course is very timely, and I believe that we are now better equipped to respond to emergencies on field and off field during football activities.
One topic that was quite interesting that actually is a bit tricky sometimes would be the topic of anti-doping, as it relates to what substances, what medications are allowed and what are not allowed. We may normally give a substance here, just for example, for a player that may have an injury for pain, but then later on we realize, hey, this is actually a banned substance.
What stood out for me was not only the musculoskeletal injuries that they could sustain, but we cover things like sudden cardiac arrests and head concussions, and how best you can manage it. I really appreciated a lot of the practical sessions. I think that's so important. It's basically the epitome of all of this, because you have to know what you're doing.
We learn how to approach the field of play when there's an emergency. We learn how to coordinate our movements while responding to on-field injuries, and also how to transport patients safely. So those are just some of the highlights of the program.
They participate, they ask questions, so they are very enthusiastic with the information and the material that we gave to them. During the workshops, you will have the opportunity to know everyone, know the level of expertise that they have in the theoretical topic that we are dealing with. So, in my opinion, the workshops are very useful for them and for us as instructors.
The benefits would be that with the training, the new improved training, and along with all the doping regulations that it involve, people or doctors or medical professionals would be able to have a more holistic approach rather than just subjecting themselves to basic medicine. Sports medicine / football medicine seeming to be improving. The key thing to focus on is once you can practice or put in practice what you would have learned over the last 2 days, essentially, you have a better outcome.
We can share experience, other countries, other cultures. We can spread the thinking of FIFA about how to take care of our athletes, meaning that we can enhance their health and provide much more care for the future.